Well, welcome back, folks. Thanks for joining me for Medicare 101, Optional Supplemental Coverage, the second video presentation in the Medicare series from Oklahoma Health and Life Insurance. I'm Florence Goins, an independent broker agent and owner of Oklahoma Health and Life Insurance. My mission and passion is helping you protect what matters most. I execute my mission by educating you about the insurance industry and its products and bringing you only the best value for your hard-earned money. If you join me for the first video presentation on the basics of Medicare Parts A, B, C, and D, you learn that Medicare is a life-saving benefit, but it's not free. It covers a lot, but it may not be enough. It has coverage gaps, and those gaps can be huge in certain circumstances, leaving you exposed to financial catastrophe. Let's start the second presentation by reviewing the things Medicare doesn't cover, things like deductibles, copays, coinsurance, non-covered benefits. The deductibles for hospitalization are $1,156 per admittance. For Part B, it's once a year, $140, and for Part D, it's once a year, $320. You have copays for hospitalization after the first 60 days of $289 a day. If you're still in the hospital after day 90, you get an additional once-in-a-lifetime 60 days, but you have copays of $578 a day. That's over $40,000 that you could be out of pocket in one hospital stay. Original Medicare covers skilled nursing at 100 days per admittance. It covers the first 20 days 100%, but the following 80 days you pay $144.50 a day. So a 100-day stay in skilled nursing could be $11,560. Then you have your coinsurance, which Medicare covers the biggest portion of it, 80%. Your portion is only 20%. But these days, at the cost of health care, if you consider an MRI at $1,500 to $3,600, your out-of-pocket will be somewhere between $300 and $1,800 for that MRI. That's not to mention outpatient services and surgeries that could be upwards of $20-something thousand. Your out-of-pocket for that could be over $4,000. Non-covered benefits include things like dental, vision, and hearing. Those are not normally covered by Medicare unless they're medically necessary. And of course, nursing home or long-term care is not a Medicare covered expense. And those expenses are running upwards of $150 per day in Oklahoma, and that's for a shared room. And the last, probably the most important thing about original Medicare, it has no maximum out of pocket. There is no stop loss with original Medicare. That is what can put you in financial catastrophe. Not to scare you, because by now you're probably thinking, geez, so is there anything I can afford to fill the gaps? And the answer is a resounding yes. There are affordable options to fill the gaps left by Medicare. Those take the forms of Medicare supplements, also known as Medigap policies, Medicare Advantage plans, also known as MAs and MAPDs, employer and retiree coverage benefits, TRICARE, veterans benefits, Indian health benefits, and of course Medicaid. So let's start by exploring the most traditional option first, supplement. So what is a Medicare supplement? They're also known as Medigap policies. They are health insurance plans that are sold and administered by private companies to Medicare beneficiaries that provide coverage for medical expenses not completely covered by Medicare. They're secondary payers after Medicare, and they're medically underwritten after your guaranteed issue period, which, remember, in the first video we explained that when you first turn 65, you have a 6-month open window during which time you are guaranteed issue if you want a Medicare supplement, Medicare gap policy. The Medicare supplements have been standardized by the Centers for Medicare and Medicaid Services in 48 states into 10 different plans labeled A through N. And in order to qualify for any of them, you must have both Medicare Parts A and B to enroll. Let's talk a little bit more about the Medicare supplement plans. They're available in the 10 standardized policies labeled A through N. And again, in 48 states, they're standardized in their offerings, so comparing their coverage is pretty straightforward. The supplement offerings for most companies will be illustrated very similarly to this slide, where the check mark under the plan represents 100% coverage of the benefit listed in the left column. If the plan doesn't cover the benefit, there will be no check mark, and if the coverage is less than 100%, the actual coverage percentage will be listed. The most comprehensive plan is Plan F. Plan F covers 100% of all Medicare gap expenses that Medicare leaves uncovered, and it also includes foreign travel emergency up to plan limits of $25,000. It is the most expensive plan in any carrier's portfolio. Plan C and G is very similar to Plan F, but C does not cover Part B excess charges, which can be up to 15% over the allowed reimbursement rate, and Plan G does not cover the $140 annual Part B deductible. Plan N is the next most comprehensive. It leaves both Part B and Part B excess charges uncovered, and it adds a $20 doctor's visit copay and $50 to $65 emergency room copay per visit. So when choosing a supplement plan, there are 4 main things you want to consider. Obviously, the first one is the plan type, which coverage is the best for you. After that, you want to consider price, because prices are not standardized between plans, companies, or states, and there can be wide variances in the pricing for the same plan between companies, so you must shop wisely. The pricing method is something that most people don't really even think about, but it's very important because it determines how your future price increases will be passed on to you. The first method is the issue age, and the premiums are lower for people who buy at a younger age, and they won't change as you get older. They may go up because of inflation and other factors, but not because of your age. The second type is the attained age premium, and the premiums are lower for younger buyers, but they go up as you get older, and they may be the least expensive at first, but they can eventually become the most expensive. Premiums may also go up because of inflation and other factors, so with an attained age policy, you could very easily get 2 price increases in a year after you turn 66. The last one is community rated, and your premium is not based on your age. The premiums may go up because of inflation and other factors, but not because of your age. The last thing to consider is, does the plan you're considering offer any value-added benefits for the increased premium? And they could be benefits like dental, vision, hearing, and health and wellness, such as a free gym membership. It may well be worth the extra premium, but you have to do your due diligence and, again, shop wisely. Next, let's talk about your second option, a Medicare Advantage plan. Exactly what is an Advantage plan? It's a Medicare health plan administered by a Medicare-approved private insurance company. You remain a member of Medicare, but your coverage, your benefits will not come directly from Medicare. They will come through the insurance company. You may pay an additional premium for the Advantage plan in addition to your Medicare premiums, which you must continue to pay. You'll receive your benefits and claims through the private insurance company, and you must have both Parts A and B of Medicare to be qualified to enroll in an Advantage plan. Medicare Advantage plans are not the same as supplements. They pay in the place of original Medicare. They must provide the same or better benefits as original Medicare for inpatient and outpatient Parts A and B. Medicare pays the plan a set fee for each beneficiary, and the plan administers all the medical benefits, the services, and the claims for the services received. They may include Part D prescription drug coverage as part of the plan for no additional cost, and they may include additional value-added benefits like dental, vision, hearing, and fitness. There are 4 basic types of Advantage plans. The first one's called an HMO, which stands for Health Maintenance Organization. The second is a Preferred provider organization, also known as a PPO. This is probably the most similar to employer-sponsored coverage. The fourth is a private fee-for-service plan, also known as a PFFS. And the fourth one is a special needs plan, also known as an SNP. They may require the use of specific providers to receive your services and get the best rates, and they may have restricted service areas. So now let's talk about comparing them. We'll talk about the advantages and disadvantages of a supplement versus an advantage plan. So the advantages of supplements are their predictable cost. You know each month and each year exactly what your costs are going to be. There are no networks. You're covered on some to all of the gaps left by Medicare depending on the plan you choose, such as deductibles, copays, and coinsurance. Some of the disadvantages are that they cannot include prescription drug benefits. The premiums are usually higher than advantage plans, and the premiums will increase over time as you age. Now let's do the reverse and compare the advantage plan to a supplement. The advantages of the advantage plans are you have usually lower monthly premiums. Most of them will include a prescription drug plan as part of the coverage for no additional cost. They may include extras like vision, dental, hearing, and wellness. They limit your expenses with set copays, coinsurance, and maximum out-of-pocket stop losses, which Original Medicare does not offer. Some of the disadvantages are they mostly require to use their networks. They may be regionally based, meaning if you live in one state part of the time, in another state part of the time, you may have difficulty getting coverage outside. In fact, you won't get coverage outside of emergency care outside of your area where you live most of the time. The benefits are not standardized between plans and carriers, making them much more difficult to compare. And the network cost will vary. They may be more expensive in the long run if you have a chronic condition like diabetes, rheumatoid arthritis, or if you develop end-stage renal disease. Some additional considerations are group-sponsored coverage. What if you already have coverage through an employer, a union, or retiree group health plan? You need to stop, or at least slow down. Before you proceed, you must review your existing coverage, because in certain circumstances, if you make a change to a group-sponsored plan, you may not be able to get back into it. So let's talk a little bit more about that. If you have VA, TRICARE, or employer benefits, before you enroll in any supplemental Medicare plan other than what you have, check with your existing medical plan provider to see if and how Medicare coordinates benefits. Is it primary? Is it secondary? And if you'll be required to purchase Part B to continue your coverage after you turn 65. Because in some cases, you may not be required to purchase your Part B if you have what's considered creditable coverage, which is as good as or better than Original Medicare, until you lose that coverage. If your plan does not coordinate benefits with Medicare and you enroll in a supplemental Medicare plan, you may lose your other coverage and not be able to get it back. That could be disastrous in certain circumstances, especially with prescription drugs if you have a chronic condition. So here's the checklist. This is a very basic checklist, and these are just the most important things. Obviously, cost is one. What is the monthly premium you're paying now versus what it would be if you make a change? What are your deductibles? Do you have a maximum out-of-pocket stop loss with your current plan? How would that be affected going forward? What benefits do you have currently? Does it include dental, vision, and life, as well as the medical benefits? And those prescriptions, are they covered throughout the year versus possibly running into that donut hole on the Medicare prescription plan? And do you have beneficiaries other than yourself or dependents on your plan who might be left without coverage if you make a change? Those are definite important things that you want to look at when you're trying to make a decision whether to stay on the plan you're on or go with an alternative plan when you turn 65. Something that's very important for you to be aware of are the low and no cost resources available in your community. There are two of them listed here. The first one is eldercare.gov, which you can access online at www.eldercare.gov. It is the Elder Care Locator, a public service of the United States Administration on Aging, and it connects you to services for older adults and their families. You can also reach them at 1-800-677-1116. Another resource is the benefitscheckup.org. It's www.benefitscheckup.org. It's a free and low-cost resource that's available to help with everything from paying your heating bills to getting food assistance, accessing disaster relief, as well as receiving financial assistance for your health care. Here are some more resources for additional information for you. The first one is Choosing a Medigap Policy, a guide to health insurance for people with Medicare. It's put out by the Centers for Medicare and Medicaid in conjunction with the National Association of Insurance Commissioners. You can request a copy of it directly from Medicare. The State Health Insurance Assistance Program is also a great organization. They have volunteers that will work with you to help you understand just original Medicare, as well as Medicare supplements and Medigap policies, as well as Medicare Advantage plan. You should contact your state insurance department in Oklahoma. It's the Oklahoma Insurance Department, or go online to www.shiptalk.org, shiptalk.org. And finally, the Medicare and You Handbook, which you will receive once you sign up for Medicare. It's put out by the Centers for Medicare and Medicaid. You can also download a PDF version of your own at www.medicare.gov, or call Medicare at 1-800-MEDICARE for a booklet. So, how do you choose? As you can see, there are many factors to consider. You start with your general health status and your budget. Consider the choice of providers. Do you need to stay with a certain provider that you've been with for perhaps your lifetime? Or are you okay with using a new provider in a network? Consider your lifestyle. Do you travel? Do you have a vacation home outside of the state in which you reside? Consider your risk tolerance. Do you prefer to pay as you go and only pay if you receive a service, or do you prefer the security of paying in advance a set amount per month or per year and knowing that all your services are included in that premium? Now you know the basic options for your gap coverage and what to look for and consider when you're comparing additional options for coverage in addition to your original Medicare A and B. Do you still have questions? We know you probably still do, and would like to invite you to call us toll-free outside of Oklahoma City at 888-810-6678 with any questions that you have, or to schedule a complimentary, no-obligation personal appointment. We'd like for you to know that we're here to help you to achieve your goals and to prepare you for a safe and a worry-free retirement. It is our mission and the highest calling of our profession to ensure that you enjoy your retirement to the fullest. Well, I'd like to thank you for your time and your attention. I hope this information has broadened your knowledge to the options that are available to you, the additional sources for more information, and the important considerations that you must review before you take any action. More than anything, I want you to know that you're not alone. You don't have to make this very important decision in a vacuum. I would be honored to assist you if you would like some help, and I'd like to ask that you share this video with your friends and family who may also benefit from expert guidance and direction as they enter their own golden years. It's been my pleasure to share my knowledge with you. I hope that you will call me if I can be of assistance in any way. Call me locally in Oklahoma City at 405-409-7884. Outside of Oklahoma City at 888-810-6678. God bless and keep you and yours in a safe and a worry-free retirement.